there, but that's the main thrust. Cut mainly for Medicare waste, fraud, and abuse. No cuts in benefits, no increase in premiums, just waste, fraud, and abuse. This is essential in order to strengthen Medicare, and in this legislation we will make it solvent for 9 more years. There's some other pieces to it that will be in there, but the main piece is the Medicare fee. It's health for health. You know, in our bill we had a surcharge at the high end. This is a health fee on unearned income, and some other features in there as well, but they're the 2 main ones.
Mr. Speaker, you said many times that one of the things that was most important to House Democrats is removing special things that were in the Senate bill. But so did you remove, aside from the Nebraska issue, did you remove the money for Connecticut hospitals? Did you remove extra money for to help Florida for Medicare Advantage, things like that? Was everything removed, all the special?
No, you will see. Okay, let me talk about what the bill is. Largely the difference between the House and the Senate bills that have been corrected are the following. We did not believe that the Senate bill had enough on affordability. So there's more affordability for the middle class in the reconciliation package that will pass. Secondly, we did not like the state inequities. So it's a category, and this bill corrects the state inequities by making the Medicaid reimbursements more fair to all of the states. That also includes rewarding do-gooder states who had been out there before, in advance of this bill, making changes to reward them for that. Third in that Medicaid piece is funding for primary care doctors who handle Medicaid cases, so that we're not adding more people to Medicaid without adding the opportunity for more doctors to provide services. The next piece of it was to close the donut hole. We talked about some of these things by way of our guest here today, but to close the donut hole. For those who are not seniors, as I am a senior, the donut hole is a very important issue to us. And what it is an undue burden on seniors in terms of their prescription drugs. And Stella Johnson spoke eloquently to that. Thank you, Stella. Another feature of this is that we did not think that the Senate bill went far enough in the insurance reforms. And that is something that we do in the bill. So in terms of the affordability for the middle class, the reforms, accountability for the insurance companies, the access to many more people that we talked about, and the equity for the states, and changing the excise tax, which is a main feature, a complaint among many of our members, to a different pay for. Those are the major changes in the bill. But it's not a question of special deals. Whatever is in there can be subjected to many people competing for it. They're capped. There's a comfort level with why they are in the legislation. We thought that Nebraska was indeed a special deal. Yeah. Yes.
Calling it a rough outlook. Are you comfortable with saying the $1.2 trillion
Yeah.
as a commitment in savings, or is
Yes. Yes, and let me say this. As you well know, the CBO is usually very conservative in its estimates. They gave us no credit for prevention, which we know will result in savings, in wellness initiatives, and initiatives of that kind, which will make people healthier. It don't give us really any credit for earlier intervention, so many more people can be attended to before their cost, and more important than that, their situation, their health worsens. So we don't get any credit for some of the upside that we know is there. And I'm going to yield to Mr. Larson because he's going to talk about health IT and the savings that will have as well.
Well, you know, if you look at any report that's come out recently, whether it's the Rand Corporation or whether it's Reuters, Reuters predicted back earlier this year $700 billion annually that's available to us. In the Rand report, they said just in health information IT, conservatively, they guessed that there's around $500 to $700 billion worth of savings that can be accrued here. part of the things that we discussed in the rollout that today was looking at hospitals and the ability of us to coordinate care. And by that we mean everything from interoperability to making sure that these cases are followed in a systematic manner with the most up-to-date technology. That's where the huge savings are going to be across the board and well into the future. And I dare say I think those are conservative estimates.
Yeah. So,
Congressman Lynch, one of your whips just came out and called the anemic mask message disingenuous, and he
I'm sorry, I didn't hear what he said.
he said that it's disingenuous, and he said that it was really calling into question the credibility of the House.
Yeah.
One of your own whips. Do you have any response to
Well, I haven't heard that he had, I mean, you're telling me that, but the fact is that what we're talking about here is the regular order that has been used hundreds of times in the House, and it's really a non-issue. But again, the poisoning of the well that you see is, again, the lengths to which the insurance companies will go. They will do anything to stop this legislation. They have made such a fortune off of the misfortune of the American people. We have played on their turf for decades without even being subjected to the antitrust laws. And now they will be playing on the turf of the American people. So what the American people should know is that this is what they're going to see a full menu of in the next few days. Misrepresentations, mischaracterizations, because, again, they're poisoning the well before members even have a chance to see. There was no decision made about how we would proceed. We talked about various options. The decision would spring from what the CBO report told us. And the urgency is even greater now for us because we know the opportunity is greater. I'm pleased to yield.
Well, perhaps Mr. Lynch was referring to the more than 99 times that Mr. Gingrich used the process, or the more than 106 times that Denny Hastert used it. But you know what our members are concerned about? They're concerned about what our guests are. They're concerned about the process which finds their policies being rescinded. They're concerned about the process that finds their policies canceled because of pre-existing conditions, or when found in a second, their policies rated or then actually taken away. Stories that lying on a gurney heading into the hospital, you have your policy revoked. That's what our members are responding to, and that's what Americans are responding to all across the country, and why this is so important.
We feel very strong about where we are in terms of how we proceed. The CBO report that we have, that again speaks so eloquently. I love numbers, they're so precise. Speaks so eloquently to the savings that are there for the American people. And our guests here today have spoken so eloquently to the needs that they have, and have reflected the concerns that are shared around the kitchen table, the dining table of families across America. So we're going to go forward now, share these numbers more fully with our colleagues as soon as we get just a few more charts. And you will see it on the internet shortly and get all of that. Then we'll meet again to see what other further questions you have. But in terms of our responsibility to the American people, to the taxpayer, to future generations, to making America not only have better health care, but to be healthier. We are grateful to our chairman. We are grateful to the President of the United States for getting us to this historic place, which will sit comfortably with Social Security and Medicare, health care for all Americans, as great progress. And the President has said we will measure our success by the progress being made by the American people. This is history, and this is progress. Go to the internet. We'll meet again soon. Thank you all very much.
Speaker Pelosi and other House Democrats talking about health care legislation. The Congressional Budget Office releasing its estimates, saying that the bill would reduce the federal deficit by $138 billion over 10 years. You can read that online at cspan.org. Understanding from Rules Committee Chairman Louise Slaughter in comments earlier today, meaning that Rules will meet Saturday likely and debate and vote on Sunday likely in the U.S. House. Right now, the House is in recess. They've been in recess due to the bill signing at the White House, and they should gavel back in